what to do. If you only had one thing to implement, if you're of the idea of, okay, I'm just going to start with one thing because I have all these things in my life, I don't have the time, the energy, the money, or whatever. What is the first thing, according to you, that people should do to have the most benefit of all and the better health improvement?
The first thing that I always say is the most important is understanding how you have the disease that you have. The first thing is always education. I mean, as a plumber, I mean, you have to go to school to learn a trade. And healing the body is kind of the same way. I mean, it's not, you have to understand why you have the disorder that you have. And the good thing about that is it's free, because if people go from doctor to doctor to doctor to doctor and they get medications and the doctor never tells them why they have heart disease, why they have liver cancer, why they have arthritis, why they have, whatever condition that they have. So also from the practitioner's standpoint of view, the patient also has to understand that the practitioner knows what the root cause of disease is. So first of all, doctors are not spending enough time with patients anyway. So if you really get to know a patient, you can tell everything about them and about their environment and then teach them about the root cause of disease. It's one of the things that made our practice so successful and still today makes everything so successful, because the mindset has to be there. Once you break it down and you tell somebody in an hour and a half exactly why they're dealing with the condition that they're dealing with, then it's a lot easier, especially when you're saying, okay, we know that all your problems and all your disease, or let me explain to you why you have that condition that you're suffering from. And most of them will say, well, no one's ever done that before. Or you can even ask them, has any doctor explained to you why you have cancer or why you have diabetes or whatever? And they'll say no. And I say, well, don't you think that you have to understand how you got the condition to understand how to get rid of the condition? I'm not going to try to lay tile on my floor or put, shingles on my roof without going through the training and learning how to do that trade first. So the first step to me is always education. It's always preparing the mind, because once that individual knows and you explain to them why it's the toxins in your food that you're eating, it's the toxins in the water you're drinking, the beverages that you're consuming, and they can see that picture and they understand all this stuff that I'm doing, all the stuff that I'm exposing my internal environment to, and all the stuff in my external environment that I'm exposed to is what's causing my problem, then they're going to be more open to going into stage 2, which is addressing the root cause and then cleansing their body. So I think it's really important as the first stage, which is free, because education is free if you go to the right people and you open your mind to all possibilities. And with the internet now, you can learn everything that you need to learn. So once you have that mindset and you understand why they're sick, then I would move on to phase 2.